For joining me this morning. Today, we're actually going to talk about Medicare and the different parts of Medicare that go along with it. So, first of all, I'm going to tackle the Part A, Part B, and C and D. So, first of all, Part A and Part B are what they consider to be the original Medicare. And the Part A aspect of this actually covers inpatient hospital care, skilled nursing facility care, hospice services, lab services, surgery, and some home health care. So you'll hear them frequently refer to Part A as being the hospital portion. Now, I want to caution you, although it talks about skilled nursing facilities, they do pay for the first day through the 20th day in a skilled nursing facility, and there is no cost for that. For days 21 through 100, there is $176 daily coinsurance that has to be paid. So when you're thinking about long-term care, don't rely on Medicare as being a long-term solution. So I just want to make sure that everybody's aware of that. Now, the Part B part of Medicare, they consider that to be the doctor's portion of Medicare. So it'll cover physician's fees, outpatient hospital care, some home health care services, medical equipment like durable medical equipment, walkers and crutches and things along those lines that aren't picked up by Medicare Part A. Now, Part B does come with a premium. I didn't mention this, but traditionally, Part A, there is not a premium that you pay, although there are some odd circumstances in which you might. So you have to understand your situation as far as why you might have to pay that. But with Medicare Part B, in 2022, the premium on a monthly basis is $170.10. And that is the minimum premium payment. It actually increases based upon your adjusted gross income. So if you've got a higher income level, you may want to check that out too, because you might be actually paying more for Medicare Part B. Now, Medicare Part C is what they kind of call the all-in-one. So it captures anything that Part A and Part B are not going to cover. They are offered by private insurance companies that have been approved by the federal government. And their standardized minimum coverage that it offers. And there's additional protection that you actually may purchase through the Medicare Part C. So it's important to understand that A and B don't cover everything, and having a Medicare Advantage or a Part C could be very helpful in your situation. Then we've got Medicare Part D, and I think it's the easiest one to remember because you think of D and you can think of drugs. So there's actually a couple of different Medicare Part D programs, and you need to understand the medication that you take on a regular basis and see if it fits into the Medicare Part D program to make sure that you're getting the coverage that you need. A good place to start researching that is with Medicare.gov, G-O-V, and you can go in and do research, in particular in the Part D section on medications that you might be taking, and make sure that you're being covered from that standpoint. Now, that is Part A, B, C, and D. So there are also what they call Medicare supplemental or Medigap plans. You may have heard that language as well. And again, they help to supplement Part A and Part B. And you have to be enrolled in both of those parts in order to take out a supplemental or a Medigap policy. Now, these are also purchased from a private insurance company, and they actually have a lot more flexibility than the traditional Medicare plans. But you have to take a look at the state that you live in and what they have to offer. In most cases, you have to be over the age of 65. If you're under the age of 65, maybe you have a disability or you're in what they call end stage renal disease, then you can qualify for a Medigap or a supplemental policy. So all of these are a little bit different, and it's something that you should take into consideration in regard to your own health situation. Because when you're going out to these private insurance companies too, you want to make sure that you're going to be able to get the care with the doctors that you're looking for, maybe the hospitals that you are associated with. There's a lot that needs to be incorporated. So many times I have the conversation with clients about having a relationship with a Medicare specialist, a broker in the system who is able to go out and do some shopping for you. It can be very complicated to try to do it on your own. So these brokers actually are have relationships with many of the other insurance companies, with the hospitals, the doctors. They really know what's going on, and they do this 24/7, so they can be helpful. So I hope you found that of interest. If you have any questions, don't hesitate to give me a call at 412-346-4655. Send me an email at diane@pearsonfinancialplanning.com or a direct message right here through Facebook. As always, I appreciate you joining me. And if you find this of interest and you think there's somebody in your life that may benefit by joining our group here, let me know. I'm happy to invite them, or you can send the invitation yourself. And as always, have a great day.